we are seeing, it's difficult to phrase this. I don't want to say we've seen more CNS localizations, because we've seen less hematological relapses. In this study, we've seen very few relapses, but we've seen a few relapses at the CNS level. Now, it's interesting, but does that go through the barrier? So it's a bit of a surprise. But I'm not saying it's more frequent. It's possibly the fact that we see less hematological relapses, so we are more alerted by these CNS relapses. So this needs investigation. We'd already reported this in the New England paper and in the New England Review that we wrote a couple of years later, published in 2022. And in fact, in the new protocol, we've intensified the CNS prophylaxis to try to avoid this problem. But at the same time, we've been studying this with a colleague in Milan, and what we've got in press, a paper, I don't know if it's out, but anyhow, because we did a retrospective study in Italy, and I think that is what you were referring to, on CNS localization, which is an issue in general. So we're investigating this, and we got a paper in press suggesting, I would want to be cautious on that, suggesting that there may be a genetic profile that predisposes to a CNS localization. This we did, as I said, with this colleague and friend in Milan. We identified a certain number of ALLs that had a CNS localization, either diagnosis or during a clinical course, compared diagnostic samples, compared to a series who never had a localization. And we identified 5 genes which appear to be either up or down modulated in common between these patients with a CNS localization. This is very interesting, but it needs to be confirmed in a larger series. This, if confirmed, would be very important, because it could mean that we would identify patients who probably need a stronger CNS prophylaxis. And the other side of the coin, potentially, but this is obviously an hypothesis, we could identify patients for whom maybe we could reduce the CNS prophylaxis. So it would mean tailoring, apart from treatment, even the CNS prophylaxis. This is for another chat later on, because we need more data on this, but that is what we're actually investigating right now.